About 2 years ago, my husband, Dale Beckman, had 2 strokes, and after that happened, his health became more erratic, and he was becoming more and more bedridden and less able to contribute to his own care. He's constantly in some state of recovery or in some state of becoming ill.
The Advanced Medical Team is a care coordination delivery system that is meant to basically take better care of our patients. We identify patients that have high-risk medical problems that oftentimes put them at risk for emergency room visits or even hospital admissions. And by identifying the patients that have these chronic problems and being proactive rather than reactive, we are able to take better care, coordinate care for them.
We had initially developed the AMT here in the hospital to help transition those patients from the hospital back into their home. We found that there was a gap in care. After doing a lot of work and evaluating that process, we did switch the AMT and the navigator into the PCP's office, and that's currently where it's at.
We want to have this a continuous access to us as the providers. We want to have that access to our patients in terms of just communication about their chronic disease. We think that the patient's experience is going to be markedly better simply by feeling engaged with a team of caregivers, not just one provider, and that access to care is a continuum, not just visit-driven.
So the role of the care navigator is to coordinate care for our patients, whether they're inpatient, outpatient, with the goal of keeping them healthy at home and meeting their goals, no matter what their goals are.
We have been very successful, I think, in engaging not only the patient but the family.
To me, it's not just care for him. Recently, within the last 5 or so days, I was sort of in a corner looking around going, what do I do next? He was becoming more and more ill, and I was able to pick up the phone, call Brooke, explain to her what was going on, how things had changed from the last time she and I talked to now. And she was able to give me help, Dale help, and connect us with Dr. Christensen. Those are big levels of help.
Weekly, we are identifying patients that are triggered by their diagnosis, by a recent admission to the hospital, by maybe number of visits they've had to the emergency department or to our own office. We are finding that our patients are getting more engaged. Our heart failure patients are actually weighing themselves. Our diabetes patients are actually checking their sugars a little bit more often. Perhaps it's because they know they're a little bit more accountable.
Through the 70 or 80 patients that are included in the advanced medical team over the past 4 months, I think we've only had maybe 2 readmissions so far.
I feel a lot more confident, more comfortable, more able to contribute to the quality of Dale's life because of the teamwork of Brooke, the nurses on the staff, the connection plus the assurance that comes with the connection. We talk, she makes suggestions, she reviews what I'm doing or not doing, and then she says to me almost every time, I'll run this by Dr. Christensen. So there are layers of teamwork and layers of support.
But I think one of the unexpected benefits that I've discovered is I really enjoy what I'm doing in a different level.
Today, he's much better than he was yesterday. Why is he different today than yesterday? Part of it is he had a chance to talk to Brooke. He had a chance to talk to Kyle. He had a reassurance. Kyle walked us through all of the things that we had done, all of the things that needed to be done, the changes that he'd seen, and the concerns that he still felt were present. And it's like somebody just washing you with warm water. And he was relaxed and he was himself again.